Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I am excited today because we have another special guest, Dr. Edward Lipsit. I just am going to give him an opportunity to tell us a little bit about his self and journey to medicine.
Hi, Erkeda. It's a pleasure to be here today. Thanks for the opportunity. Well, I started my professional career attending Georgetown University School of Medicine, followed by training in diagnostic radiology at George Washington. Then I did a fellowship in diagnostic ultrasound, which was an area that was particularly interesting to me at Johns Hopkins. And then I went into, I went back to GW to run the ultrasound division for a couple of years. And then I went into private practice in the DC area, and I've never looked back. And I found it to be a very rewarding career. And now, following retirement from my clinical practice, I've really had a great run, a lot of enjoyment working with prospective medical students, helping them with the application process and assisting them when they try to fulfill their dreams and become a physician.
That's awesome. We'll definitely talk and try to pick your brain for some of those tips for our listeners out there who may be in the application process or starting it soon. But I want to take it a little further back to when you decided what specialty you wanted to choose for those listeners who may be in that part of the process. What inspired you to choose the field of radiology?
Well, I'll go back even a little further, if I may, and also address, why a physician. And, I think there were a number of factors. It was kind of a checklist. Certainly, I enjoyed science, and I wanted a career that would be academically challenging. And although it may sound a little hokey, I wanted to try to make a difference, do something with some social impact. And when you put it all together, the academic challenge, the science aspect, and the fact that I really did want to do something meaningful, and that's something that's reflected in my conversations with potential medical students. So they say that over and over again, which is a great motivation. It seemed like medicine would be the right career for me. And when I was in medical school, especially during my clinical rotations, I found that to be just a terrific opportunity to examine the various areas in medicine that I might be able to enter. And that's one of the, sometimes, people ask me, well, why is it so exciting to go into the field of medicine? And I think it's because of the opportunities, which range from research to very active clinical practice, working with people, working with patients. I think you have to know yourself, what is going to be personally and professionally fulfilling. And so I didn't just participate in the various clinical rotations, but I was also observing. I guess you could almost call it a couple of years of shadowing, where I watched not only what physicians did, but I watched the physicians themselves in terms of their personalities, lifestyle considerations. These are all very important because this is something that, hopefully you'll be doing for many years, 20, 30, 40 years, especially with, I think, an increased, I'd say almost quality of life. Physicians are practicing longer and longer. So you're going to be doing this for a long time. And it's important that you know what you find fulfilling. And, that led me to diagnostic radiology for a number of reasons. I kind of saw the radiologist to some extent as the doctor's doctor.
Absolutely.
All roads seem to lead, especially when I was in a hospital environment, all roads seem to lead to the radiology department. And then when I went into clinical practice, into private practice, again, fielding problem-solving phone calls all the time. And I found that clinicians more and more have become dependent, and rightly so, on diagnostic imaging. the field itself has exploded in terms of, the number of options that physicians have in terms of diagnostic imaging. I love the toys, by the way. We have very cool toys in radiology. And so I guess when you add it all up, it was the ability to be a consultant, to also work with patients, and to be a diagnostic problem solver. Those areas appealed to me. And what I would suggest to your listeners is that when they do enter medical school, that they become keen observers, that they know themselves, they know what they like, and maybe what they don't like, and to find a niche within medicine that will satisfy them over a long period of time. I think that's the key element.
Absolutely. I couldn't agree more. And I love the description of radiology, like the doctor's doctor, because that is so true. I'm a family physician, and it just fascinates me how, I guess we theoretically in family are known to know a little bit about a lot of things. And I feel like radiologists know a lot about everything. and you're always the differentials are so vast just by looking at imaging. So it's very fascinating. You mentioned earlier that you advise medical students on how to successfully navigate the admissions process and things like that. What are some of the challenges that you may note that some students run into?
Well, the entire process is sometimes it's complicated. I mean, it can be almost circuitous, you could describe it. First of all, simply the pre-med curriculum, at the undergraduate level is obviously very challenging. It could also be, and this is unfortunate, it could also be somewhat restricting because people, obviously they must focus on the requirements, the undergraduate requirements. And that's a tough haul. So clearly, academic success is critical. It's crucial to the process. Of course, you have the MCAT to deal with, which again is it's more of as an exam, it's more of a marathon than anything else. And the fact is, and this is interesting, many of my colleagues don't realize this, but my becoming involved in the application process with Med School Coach has demonstrated to me that medicine is as popular as ever. It's pretty amazing, and it's encouraging. But the numbers keep increasing. Unfortunately, the number of seats, the number of spots in the medical school community has not increased in proportion, has not kept up with the increasing number of applicants. So the downside, of course, is that many very worthy individuals struggle to get into medical school and may not be successful. But let's look at the more encouraging aspect, and that is, with academic success, especially during the undergraduate years, people obviously can become competitive for medical school, but then they have to go through an application process that is really, again, quite complex, and it's becoming increasingly complex because schools are being inundated with applications for a limited number of seats, and they have to screen so many of these worthy applicants. And so they're looking at more and more types of screening tools, which include, of course, the metrics, additional, you could call them examinations called situational judgment tests that are being introduced. There's also, of course, the application itself, which has multiple parts. Now, the metrics are important, of course, but what's becoming increasingly important, and for good reason, are the work and activities section of the application. Very, very important, because the categories that need to be filled, and this is probably one of the more important parts of this talk, individuals who are contemplating medical school, they have to plan. They have to plan in advance. Last minute decisions will not work unless they take several years of gap time, because they must fulfill categories. And the categories make sense, to tell you the truth. They really do. Let's talk about them briefly. Mm-hmm. We could start out with, of course, medically related activities, and that makes a lot of sense. You want to be sure that the individual knows what they're getting themselves into. So there's both active and there's passive. Active is where you're really in the trenches. Maybe you're an EMT, you're a paramedic, you're a scribe, or you're simply working in a physician's office and participating. Very important. But there's also a passive medical activity called shadowing, and that is where you're simply observing, but that's not to be underestimated. It gives the admissions committee confidence that you know what you're doing, you know what you're getting yourself into, because the great committee failure is, I like sports analogies. It's like I'm a general manager and I get a first round pick and it's a bust. And the great failure is when they accept somebody who looks terrific on paper, but it's not a great career choice. And nobody knows it at the time. And later on, everybody's unhappy. So they want to avoid that. And if they see somebody with a robust description of witnessing, observing, of shadowing, it gives them confidence that they don't have to worry about you. You know what you're getting yourself into. So that's the medically related. And that's very, very important, of course. But then we have to move on, because medicine is not just the academics. Then we move on to volunteer work. It could be medical or it could be non-medical. It could be very exotic, such as a medical mission to outside the United States, or it could be something much closer to home and something simpler but very meaningful, working in a senior citizen center, working on, with blood drives, just all sorts of community-based activity. What does that demonstrate? Demonstrates altruism. And that's at the core of all this. You must be altruistic, again, going into medicine for the right reasons. And then there are also other areas, such as leadership. I think the best doctors are also leaders within their community. Another area is teaching or tutoring, because I think you'd agree that the best physicians are educators. Yeah. They're teachers. It's no more of this paternalistic, I went to medical school, I read the textbook, do what I tell you, where you're dictating care. Mm-hmm. Now we talk about empowerment, partnership. You never ask a patient to do something that they don't understand. And that also leads to compliance, right? So you have to be an educator. So they look for teaching, tutoring. Work experience, that's also very helpful. It shows a good work ethic. And also there are other categories like honors and awards, but and also research, by the way. We could debate how important that would need to be, but the fact of the matter is that, again, great doctors at least understand the significance and the importance of research. And I find that they're not mutually exclusive. Great researchers understand what the clinician needs, and clinicians understand that in order to practice the best evidence-based medicine, research is critical. So, I've just described the activities, and as you can see, that takes planning. I mean, those categories can only be filled over a number of years. So sometimes I work with an applicant where there are voids in their activities list, and it's sort of last minute. And I say, there's a limited amount that we can do. So I would urge your listeners who are interested in a medical career to plan, think ahead, and try to develop a robust activities list. There are a couple of other areas that I'll touch upon briefly. Of course, letters of recommendation. Very, very important. It's important for individuals to develop, meaningful relationships with their mentors, with their teachers, with maybe supervisors if they have volunteer or work experience. So that's another, very important area. And so, as you could see, the application process, planning is required. And by the way, I would also mention that applicants don't have to go it alone. I mean, there is help, of course. There may be help on their campus, or of course, there are outside services that can be helpful. But plan. That's my recommendation.
I love that. And I appreciate you for going into such detail about the different components of what really helps an applicant shine. And we know like everyone won't necessarily hit all of those, but just being true to yourself, as well as kind of making sure that you're in it for the right reasons and that you have had the exposure that kind of showcases that you understand what will be required of a physician, and having those skills, like you said, like of teaching and things like that, that are transferable, because doctor does mean teacher, and you will be doing it for a long time, and also in different realms, not only with your patients, but when you're teaching other students or other residents and physicians about different things as well over time.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and AMCAS scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
How can a student maximize highlighting their strengths during the interview process?
Well, that's a great question. Often, applicants will ask me, what's most important, during the interview? How can I sort of separate myself out from the rest of the crowd? Now, the interview is so critical. And by the way, simply getting an interview is an accomplishment. For many of these institutions, less than 10% of this enormous applicant pool gets interviewed. So by the time you get to that level, they know you can do the work. Trust me, they are not about to interview somebody who they have doubts about, the academic accomplishments. So why in the world are they either doing a virtual interview or, in the old days, calling you in, maybe having you travel thousands of miles, just to meet you? Well, I know this is going to sound ridiculously simple, but they really have to like you. And the reason is because, now the type of interviewer, it varies widely, and that's out of your control. But let's just go through quickly the types of individuals who probably will be interviewing you. Now, the most common, if it's a traditional interview, the most common will usually be this duo of a faculty member and a med student. And they're using med students more and more, and it makes a lot of sense. They're kind of your contemporary or your peer. And if it's a med student interviewing you, they're looking at you as a potential classmate. If it's a faculty member, they're looking at you as one of their students. If it's a clinician, and again, they're more and more, they're using clinicians who have they could be, clinical professors, they're practicing in the community, but they do have a relationship with the medical school. They're looking at you as a potential colleague practicing in their community. So what they're thinking, what they're saying to themselves is, do I want this person on the medical campus, or do I want this person in my community practicing medicine? Because they know you're qualified. You've made it through a brutal screening process just to get the interview. And when I do mock interviews and I meet with applicants, I congratulate them for getting the interview, quite frankly. And then I say, now it's exciting. Now it's almost a toss-up. We're getting really, really close. And, there were also some fairly basic, simple things that they need to do. Some little tips in terms of presenting themselves as best as possible. I'll briefly go over a couple of things. Much of this is intuitive. It's not all that difficult to understand. Obviously, they have to, maintain good eye contact, have a non-distracting background, be professionally dressed. But one of the most important things, I think, is to be sincere. Let me emphasize that, because what you always want to avoid is what's called manipulative behavior, where you're trying to second guess, or you're overthinking, where you're trying to tell the interviewer what you think they want to hear. And that's usually, in my opinion, not a good idea. Be honest, be sincere, be true. That'll usually kind of shine through. And so that's one tip. And another tip, of course, these interviews, and applicants who are granted interviews will soon learn this. They can be very brief, amazingly brief. And it's a real challenge. How do you get somebody to know you and to motivate them to recommend you in a committee setting? How do you do that in a period of 30 minutes, which is really very brief? What I tell applicants often is, in a perfect world, you go before the committee and we'd give you 15 minutes or 20 minutes, you'd plead your case, and I'm sure you'd do very well. They don't get the opportunity to do that. They are asking basically a stranger to interact with them for a very brief period of time, and then to be their conduit to the committee and to basically go to bat for them, to advocate for them. And that's the goal. That's the goal. And so one way to help in that process is to be focused, not ramble, and get to the point, because many times interviewers, they have a list of mandatory questions as well as some optional questions, or some questions that they come up with themselves. But you have to be respectful of their time, right? And so I find that a nice, focused, sincere response usually wins the day.
Mm-hmm. I love that. And I want to highlight as well about like the sincerity and being who you are as a person, because like you mentioned, these will be your future colleagues or professors or people that you're going to interact with almost daily. So you want to make sure that not only you're a good fit for them, but they're a good fit for you. So if you're not bringing your true self to your interview, you may end up going to a place that doesn't fit where you belong or where you would like to be. So being honest and being sincere is very important, as well as we're all human beings. We've all been in meetings and met people or interviews. You can kind of read when someone's not being authentic. So you don't want to be labeled as that. So
sure. Another thing that I do want to mention is, obviously it's important to be comfortable with the format. Mm-hmm. Right. So practice through mock interviews is always a good idea, and to be accepting of constructive criticism, so that you kind of fine tune, your performance. So some degree. I mean, you're walking a fine line. You never want to be so tightly structured that it seems like you're reading off a teleprompter. That's a bad idea. However, you still want to be comfortable with the format, to anticipate some of the basic questions that you're going to be asked. So mock interviews and practice, becoming comfortable with the format is always a good idea.
That's so true. Absolutely. And that's the beauty of a lot of the interviews during these interesting times being virtual, because you can practice utilizing the platform that they use. A lot of places use Zoom, some other people use other things, and sometimes you can actually record what you're doing. So say you and I were doing a mock interview, you can give me feedback, and as I'm recording it, I can go back and watch how I responded to certain things, so that I can try to figure out a different way to word potential questions while still being true to myself and not super rehearsed. So exactly. There are definitely benefits to it.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
So I definitely appreciate all of your words of wisdom and tips about how to kind of ace the interviewing and application process and put your best foot forward. I'm going to shift our conversation a little bit for my next question, because I've been finding some really interesting responses when I ask this. So if you had a magic wand, what is something that you would like to change about healthcare?
Well, I think this is probably a pretty common answer, but I think that doesn't make it any less important. You know, our healthcare system is simply too complicated and it's overwhelming for most people. Look, I'm in the medical profession and I don't completely understand it. It even befuddles me sometimes, especially when I get back an explanation of benefits page. You know, good luck. and that's not the way it should be. I mean, look, if you believe, as I do, that healthcare, it's a right, it's not a privilege, then how in the world can you how can you expect people to get the healthcare that they desperately need when you're placing obstacles and hurdles that prevent them from getting that care? And I know it's very frustrating, both to me and my colleagues, when we are confronted with a system that's so complicated that it literally intimidates individuals. They find it very confusing in terms of, certainly from a financial standpoint, especially with the third-party payer system that we have, which is complex. And, you know, so the flip side, though, is, so, you know, what can we do? Now, you can look at it on a macro level and say, well, let's make, you know, institutional changes to healthcare policy in this country. And of course, that's an extraordinary challenge. But on the other hand, maybe there are little things. There are small things that we can do to chip away at the obstacles, such as helping our patients understand the complexities of, let's say, their insurance issues, having clinic hours that are more consistent with the difficulties that people have making time to come to a physician's office. Maybe we can help them with the geographic obstacles, with the transportation needs. Maybe we can look for ways to help them with the high cost of drugs and medications, where people resort to getting pill splitters because they're worried about the cost of medications and they're trying to stretch it out. Maybe we can be more culturally competent, so that we can be certain that we have the translators, the interpreters, or understanding some of the cultural norms that may actually prohibit patients from seeking care, because we need to gain their trust. So, you know, it can be done, of course, on a grand scheme, a grand level, but I also like to think small sometimes. And as individual physicians, you know, give you an example. Let's say patients are having difficulty keeping their appointments. Let's say there are problems with patient compliance. Well, instead of getting frustrated or instead of getting angry, how about if we talk to our patients and we say, why? Let me understand the hurdles that you are experiencing, and maybe I can chip away at those. I could do something to try to eliminate some of these barriers that they face and make sure that they get the care that they deserve.
That's awesome. And I think that a lot of those suggestions are what a lot of people are hoping to implement into an bring into healthcare. And hopefully this next generation of physicians out there, those listeners, you guys can help us work to advocate to change some of these things. So it's an exciting time. My final question for you is kind of, what is one piece of advice you'd like to give to both pre-med and med students who are at the beginning of their medical career journey?
Well, I think it's important that you know yourself. You know what is going to give you personal and professional fulfillment, and to choose wisely. To again be a student, but also be an observer. And of course, during the course of your life, you can be nimble and you can change course. I'm not saying that you can't do that, and I've seen many people do that with great success. But I think right from the outset, it's important for every individual to understand themselves, their motivations, and basically to choose wisely, especially within medicine, because my goodness, there's so many different types of medicine that can be practiced. It's sort of just the term going into medicine is like a huge umbrella. Mm-hmm. And there's so much that you can do. And I think if you understand what you're going to be good at and what you're going to enjoy, and the two are related, by the way. Generally, people who enjoy their work are very good at it, and people who do not, well, it's a daily struggle for them, and that's unfortunate. Mm-hmm. So I guess I don't want to engage in psychobabble, but figure yourself out, and then pursue that path.
I love that, because that takes a lot of reflection and kind of figuring out, especially as students are navigating through the different parts, even like choosing your own specialty. Things may have flashy lights or be cool for a moment, but definitely take that time to reflect and think about what you like about it. And if it's something like you mentioned, that a lot of people will be practicing for the next 30 years or more. So is it something that you want to continually show up and do every day, in and out? So I love that. And I really appreciate you for taking the time to come and share all of these pearls of wisdom with us. And hopefully the students, you guys have learned something here. If you guys have any more questions, I'm sure you'll reach out to Med School Coach and figure out if you need some extra additional help. And I'll give you an opportunity to just tell everyone goodbye.
Well, it's certainly been my pleasure, and I wish everybody the best of luck. And let me just underscore the fact that I think that a career in medicine can be extraordinarily rewarding, and best of luck to all.
Thank you so much. And for all of the listeners out there, definitely click that subscribe button if you haven't already, and I'll see you again next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.